everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to talk about how to study for psychiatric nursing. So let's get into it. Your course on psychiatric nursing will likely be called mental health nursing, and that is going to be the focus. It's important to note that mental health care can be done in all settings. So when you think about it, you're probably thinking about like inpatient psychiatric treatment, which yes, of course, that is a big part of it. But mental health nursing is everywhere. It's in the clinic setting, the community setting, the home environment, everywhere. So just keep that in mind. It is a large amount of content, which is why a lot of students find it so challenging. And a lot of it is not super relatable to maybe other things you've learned. So maybe you have a basis in med-surg, you feel very comfortable with like patho and things like that. But then when you get to mental health nursing, you're like, I can't connect the dots between these things. And that is something that can make it more challenging. Its main focus is on symptom management. So in other aspects of nursing, right, it's going to be treatment and cure. Those are going to be our main goals. In psychiatric mental health nursing, that's not always realistic. So our focus is going to be on symptom management. And there are a lot of medications to know in mental health nursing. And sometimes what they're classified for is not what they're necessarily used for. So maybe a med is an anti-epileptic, but we use it as a mood stabilizer. So that can also make it a little bit confusing. So now that we have a little base knowledge about mental health nursing, let's talk about some tips and tricks. Because there is so much content in mental health nursing, it can be overwhelming. So a couple of ways that you can help remember it. First off, you can group information, and there's a couple of different ways you can do that. You can do condition plus related medications, or you can do by disorder type. So you could do all of the personality disorders, all the nutritional disorders, things like that. So whatever works best for you. Grouping information is going to help you remember it though. Our key focuses in psychiatric nursing are on therapeutic communication. So you're going to get a lot of questions where it will say, well, what would you say to the patient? Or which of these, responses is the most appropriate way to address the situation? So focusing on therapeutic communication, understanding what you as the nurse would say to the patient in that given situation. Safety is key. Sometimes these different mental health disorders can be dangerous, right? The patient is in danger, maybe the nurse is in danger. So safety and situational awareness is going to be key in those sort of questions. Medications, of course, there's a lot of variety of medications, so knowing the different meds and what they're used for. And then everything always goes back to Maslow's hierarchy of needs. So if you're ever in a pickle and you're like, oh gosh, what is my priority? What should I do? Always go back to Maslow's. Other things you can do, make your own study guide. Well, how do I do that? So you're going to take the learning objectives that your instructor should have in the beginning of your lectures, or they're in the beginning of the chapters of the books. Look at those learning objectives and use that information to make your study guide, because that's the most important information. That's the information that your instructor wants you to know. That's what they want you to get out of the lecture. Read your content daily, and if you can, aloud. So reading out loud can help you remember it better than just sitting there and reading it. Sometimes we're trying to focus so hard on reading the content, and you'll say, okay, I've read all these pages, I have not retained any of this information. So reading out loud is something that can help you retain information. And going over stuff every single day. Now I'm not saying read the whole book every day, right? Make little schedules, that's down here. Setting a study schedule. Make yourself a little schedule, like every day for a half an hour, I'm going to read the chapters we're doing this week. Or I'm going to read pages 1 to 15. Something like that. Reading every day is going to help you remember the content, and it's going to help you to understand the content. Make flashcards or get a flashcard app. Record your lectures. I really like it when my students record my lectures because there's never any confusion about, wait, what did she say in class? I took the note that says this, and no, my buddy took a note that says this, and they don't match. So recording lectures is really helpful so that you don't miss anything and you don't write anything down incorrectly. And then color coding different content. This is kind of related to grouping information. So for example, you could put disorders, let's say personality disorders, in various colors. And that way you know, okay, these are all the personality disorders. These are all the antipsychotic medications, the bipolar medications, things like that. So grouping things by color is going to be helpful in you remembering it. Because you'll be on the test and you'll be like, okay, I remember I wrote it in green. So color coding and categorizing information is going to help you recall it better. So these are some of my simple tips and tricks on how to study for mental health nursing. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.